My name is Simon Wallace and I'm the Chief Clinical Information Officer at Nuance Communications. And I'm going to be talking about in this presentation the role of speech recognition in improving the quality, speed and turnaround of a clinician's documentation. I'm going to start by looking at the complexity of healthcare and over the years what this has meant for clinical documentation. But then ask the question, can digital technologies such as speech recognition help? I'm going to give some examples of some case studies where this has been used in the NHS in the UK, and finishing up by looking at other solutions in which AI-powered speech recognition can actually help, resulting in what we call the clinic room of the future. So let me start with this wonderful quote from Professor Sir Cyril Chandler, who way back in 1998 said, "Medicine used to be simple, ineffective and relatively safe. Now it is complex, effective and potentially dangerous." And this is so true with what we've experienced over the last 3 to 4 months with the COVID-19 scenario. But what this has meant is that clinicians really need to be documenting their clinical care in detail and in great quality. And you can see here how we've moved on from the paper world and we're into the world of the EPR. But even still, the role of the clinician in documenting is absolutely paramount. We did a survey 2 or 3 years ago looking at how much of a challenge this is, and we found that clinicians spend around 11 hours per week adding to their clinical documentation. Doctors slightly longer than nurses. And when you look at the figures of almost 1 in 3 doctors that are burnt out or stressed, then what this has meant is that clinicians are overwhelmed and demotivated by the excessive admin that they have to deal with, and particularly clinical documentation. So, can digital technologies such as speech recognition play a role to actually ease some of this burden? Well, I'm going to be talking about clinical speech recognition, and I thought it'd be worth just describing exactly what I mean. When a clinician talks into a microphone, he can see the words that he's speaking turn as text wherever the cursor might be. And that might be at a point in the electronic patient record, it might be in a Word document, or it may be in his or her email. It's what we call dictating at the point of cursor. Now we speak 3 times faster than we type, so it's going to speed up the process of documentation. And it's now the accuracy, and today the accuracy is at industrial strength. And there are 2 reasons for that. One is the smart AI and deep learning that sits behind the algorithms of the speech engine. And the second reason is a comprehensive medical dictionary, which allows those complex medical terms and drug names to be picked up. Unlike in the past, there's no need for any initial training of the speech engine with your particular voice. You can use it straight out of the box. And by being in the cloud, your single voice profile can be accessed from a whole range of different places. It could be in clinic. You could be just finished a procedure in the operating room. Or if the security allows, you could be at home accessing your patient's notes there and catching up on your documentation. You can also use speech-activated macros to speed up the quality and the speed of the documentation. And then finally, the way that speech gets into the EPR is either through a handheld microphone, or, as you can see on screen here, an app which is a microphone on your smartphone. So, does it work? Well, let me spend the next few minutes giving you some examples where speech recognition has been used in a number of different scenarios in the NHS. Let's start in the outpatient setting and describe 2 large hospitals, one in Oxford and one in London, where they all had high clinical correspondence volumes, but they were missing their targets of getting the outpatient letter to the GP within the required 7 days. They also had admin staff shortages due to sickness and vacancies, and they also had high outsourced transcription costs. And the clinicians were staying late to catch up on their admin after they'd been doing clinic. So what was the outcome? Well, the whole workflow changed, so it became a paperless outpatient letter workflow, where the clinicians were using speech to create their letters. This led to the turnaround time of the letters being reduced from 17 days to around 2 to 3 days. And if there were no pathology results being awaited, the patient would be able to leave the clinic with their outpatient letter. There were also financial savings. For example, one hospital in London saved around £180,000 per year by reducing their costs on the outsourced digital dictation. And there were also reduction in staff costs such as bank and agency staff that were being used to try and reduce the backlog. From the clinician's perspective, they felt that they were giving a better level of care and spent less time catching up on paperwork after the clinic. Both these hospitals have now had an incremental rollout of using speech recognition as the way to create their outpatient letters. And I've given 2 links there to 2 case studies that you can read in your own time. And here are a couple of quotes from a couple of people in Oxford about their experience of using clinical speech recognition. So let's move to another area of the hospital, the busy ED. This is an example where typing and handwriting of the notes was replaced using speech recognition. And what they found is that the time saving was around 40% faster using speech compared to typing. That was an average of about 3.5 minutes per patient. And if you amortize that over a period of a year of all patients coming through the department and all clinicians using speech recognition, that was equivalent to 389 days saved, or the equivalent of 2 full-time ED doctors. What did the clinicians think? They thought it saved time, it reduced delays and improved the flow of communication, and it actually improved the quality of the patient record. Let's look at the histopathology department. In this particular example, they had a significant backlog of reports, but by introducing speech recognition as the way of creating those reports, their turnaround time is now meeting the national target, and their backlog has been completely erased. And the lead pathologist, as you can see, sitting in this slide here, said he would not work in a hospital without speech recognition. So let's come out of the acute sector and go into the community setting, where a group of physiotherapists now use speech recognition to create their outpatient letters. And they had a significant reduction in turnaround time, reduced from 6 to 12 weeks down to 2 to 5 days. Any backlog they had was reduced, and importantly for them, they were able to do all their admin within contracted hours and be able to go home on time. And again, there's a case study that you can access here. We have found similar findings in the mental health setting, where any backlog that there was reduced to 0. And what we found here was it increased the electronic health record adoption, giving these clinicians what they felt was more time to care. And I've put a YouTube clip link here, which was a clip that they actually produced themselves of the experience and benefits they had of using speech recognition. And then finally, in the primary care setting, speech can be used equally well there as in the settings I've previously described. And here, a GP practice in Scotland found that using speech recognition was an absolute godsend during the COVID-19 crisis. And here are a couple more quotes from other primary care settings where they similarly found benefits by using speech recognition. So I thought I'd show you this wonderful painting by a 7-year-old girl. This is her here. She's in clinic actually, having an outpatient appointment. And here is her sister reading a glossy magazine. And here's her mum with her newborn baby. And here on the left-hand side is the poor clinician who you can see is hunched over his desktop, entering in the details. Well, when he received this painting from the 7-year-old girl, and the consultation was a complete success, by the way, he was absolutely mortified that this was the perception that this girl had of him sitting over his computer. So it begs the question, how can these technologies now help to take some of this away? Well, once you have speech recognition in your organization, then it acts as a foundation for other AI-powered speech recognition solutions. So using natural language processing, there are a whole range of other benefits that can arise. For example, the specificity of a clinical term, the quality of a clinical term can be improved. And that clinical term can have a code attached to it, a SNOMED CT code or an ICD-10 code, whichever is used within the organization. What I call allowing clinicians to code at their fingertips. And then by parsing a number of documents within an episode of care, natural language processing can actually make suggestions to say that there may be a missing diagnosis because of clinical terms that it's found. And being able to link to knowledge databases such as UpToDate, the clinician can then have voice-commanded information at his or her fingertips at the point of care during the consultation with the patient. We've talked about the electronic patient record, absolutely necessary, but it's added a number of clicks to the workflow of the clinician. Virtual assistants allow me to use my voice so that I can say, show me the last CT scan, or show me the latest ultrasound report, and bring that up automatically without having to click through a number of keys on the keyboard. And this all comes together in something called ambient clinical intelligence. And let me describe what ambient clinical intelligence is. AI-assisted speech technology. Out goes the desktop computer, and in comes a multi-sensory wall-mounted microphone array, which you can see in the diagram here in the slide. It also has integrated machine vision for motion tracking, so that if a patient says to me, my knee hurts here, and she points to the right side, that can be picked up and actually documented appropriately. Voice biometrics allow individual speakers to be identified, and it's also used as a sign-on for the clinician to access the electronic record. My voice is my password. And by using ambient skills such as virtual assistants, I can actually access different parts of the record, as I described slightly earlier. Show me the last of something, or start my knee pain pathway. And what happens during a consultation is the whole conversation is diarized of both the patient and the doctor. And the natural language processing, or what we call clinical language understanding, in the background is pulling out the key clinical terms and creating a summary note with key headings and clinical terms coded appropriately with either ICD-10 or SNOMED CT. So let me show you what that looks like with a consultation between a doctor and a patient.
Welcome to the future of medicine, where ambient clinical intelligence creates a better experience by enabling care teams to focus more on patients and less on technology. Ambient clinical intelligence listens to physician-patient conversations while providing workflow, task, and knowledge automation, allowing clinical documentation to write itself, all within the EHR. It's a future made possible by combining decades of healthcare experience, driving clinical, quality, and financial outcomes, with Nuance's experience across industries. Beyond healthcare, Nuance AI innovations benefit millions of people through their everyday lives, whether in the car, watching TV, or communicating with the world's leading banking, travel, or consumer brands. Nuance is there. These collective experiences and unique capabilities allow Nuance to move human conversation to the forefront, putting focus back on the patient. We use the latest in AI and machine learning, combined with ambient sensing technology and voice biometrics to do just that. Now watch as ambient clinical intelligence captures and contextualizes every word of a patient encounter.
Hey Dragon, let's get started. What can I do for you today?
It's my right knee. For about the last 2 months, it's really been hurting anytime that I sit down or stand up.
Now, didn't we give you an injection in your left knee a while ago?
Yes, but I don't remember when that was.
Let's see if I can find it. Hey Dragon, show me the previous procedure notes.
Aside from accurately
Okay,
capturing
looks like we
every
did that
word,
last summer.
user-initiated
Right,
virtual
now it's my right
assistants
knee.
help get information in and out of the EHR.
And where does your right knee hurt?
It's right here.
And
So you have
integrated
pain on the
machine
inside of
vision
your right
detects
knee. Is there anything that
nonverbal
makes that
cues
pain
to
better or
support
worse?
even greater
Yes,
documentation
so it's better
accuracy.
when I'm sitting or lying down, but when I stand
Physicians
up,
speak
that's when it
naturally,
burns
and
inside
key
my knee.
information is translated into clinical terminology.
So you have tenderness over the inner joint line of the right knee.
Intelligent
with mild pain
summarization
on
turns
full range of
natural
motion.
language into
No
coherent
tenderness of the left
sentences.
knee and normal range of motion. I do feel some moderate crepitus in the right knee and mild crepitus in the left knee. Have you been taking any medication for the pain?
I have. I've been taking
Beyond
care
what the
of arthritis.
physician
I
says,
had tried
relevant
Tylenol.
patient
I get
responses are
something for
added
knee
to
or
the
health
clinical
talk.
note, eliminating the need to re-enter information.
Alex, my assessment is that the cartilage in your right knee is worn out.
Ambient clinical intelligence extracts problems as coded information that physicians can verbally accept and add to the problem
That
list.
does not sound good. Is there anything we can do?
For sure. First, let's start by
Orders are
decreasing the
automatically
inflammation in the
identified
right knee
and queued
by
as
giving you a
pending.
strong anti-inflammatory
From here,
called
the
Motive.
virtual
That should
assistant
help
engages in a
take 15
conversation with the
milligrams once a
physician
day.
to complete
Okay,
the
sounds
orders
good.
and sign the note,
2 weeks, I
further
want you to
reducing
start physical
burden
therapy
and
to
eliminating
strengthen your
rework.
quadriceps. And then in 6 weeks, I want you to return and see me. If you're not significantly better by then, we'll talk about doing a cortisone injection and getting an MRI of the right knee. Does that sound like a plan? Do you have any questions for me?
No questions. Thank you for all your help.
You're welcome. Why don't you come with me? We'll get you checked out.
Nuance delivers an enhanced provider-patient experience that closes the gap between clinical conversation and clinical documentation. Ambient clinical intelligence unencumbers providers from administrative burden while preserving the patient's story and supercharging the EHR workflow. It simplifies information retrieval and delivers intelligence at the point of care. Get ready for the future of medicine and clinical documentation that writes itself.
So as you can imagine, this stuff is all pretty complex. And Nuance and Microsoft formed a partnership back in 2019 so that the AI expertise from both of our organizations could be accelerated and bring this technology to healthcare much faster, and hence play a significant role in reducing the burden of clinical documentation. I'd like to finish there. Thank you very much for attending. And if you have any questions, then please feel free to contact me on the email address on screen. Thank you.